What happens when the people who work right alongside us don't see how their work connects to public health? Today's story is about a wellness director who knew her work was public health, but her boss didn't. And that disconnect had real consequences. Let's talk about why these gaps exist and what we can do to bridge them. You're listening to the PHEC podcast, episode 438. Welcome to the Public Health Epidemiology Conversations podcast, where we dive deep into the topics that matter most to public health professionals creating change in communities around the world. I'm your host, Dr. Charlotte Hughes Huntley, and today it's just you and me as we explore a topic that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. The support that we provide often falls in the category of strategic planning or sometimes capacity building, just depending upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. Today, I want to take some time and talk with you about a problem that's costing us opportunities and leaving talented professionals frustrated. It's about the gaps and understanding that exist even within our own field. When people who work adjacent to public health simply don't see the connection to what we do. The story I'm sharing with you on this episode is about a wellness professional who understood that her work was public health. She saw an opportunity to bridge two departments that could naturally collaborate, but leadership couldn't see what she could see. The opportunity was lost. Let's dive into the story and talk about what it means for all of us working in public health. Let's start with the missed connection. I want to share this story that perfectly illustrates a challenge we see far too often in public health. The failure to recognize the breadth of our field and the opportunities that exist at its intersections. A few months ago, a director of student wellness services at a university heard about an upcoming large public health conference. She immediately saw the connection and the opportunity. She understood that wellness is public health, and she wanted to attend to represent her department and make those connections visible. So she approached her department leaders with a proposal to send her to the conference. She explained the value, the alignment of their mission, the opportunity to recruit students and expand their reach. The response? Her ideas were dismissed without any real consideration. Her boss couldn't see the connection between wellness and public health. To them, these were separate spaces, separate fields. And the message was clear. That's not us. That's not what we do. Here's what makes this even more frustrating. The same university, their formal public health department, was already planning to attend the conference. They had a booth reserved in the exhibit hall. And this wellness director saw the perfect opportunity. She could work at that booth, represent the wellness perspective, and bridge the two areas that should naturally be connected. She could show students and attendees that wellness is part of public health, that these fields overlap and strengthen each other. But because her boss didn't understand that wellness is also public health, the opportunity was lost. Now, why does this matter? You may be wondering, why am I bringing this up? I think it really matters. This story reveals something critical about the landscape we're working in. There are organizations, departments, and institutions where leadership still doesn't fully understand what public health encompasses. They're missing the connections, the overlaps, the opportunities that exist at these intersections. And here's what's particularly frustrating. This wasn't even about budget. It never got to the point of discussing whether or not they could afford to send her. The ideas were dismissed before they even were truly considered. Leadership didn't see the value in the first place. They couldn't understand how it was relevant to their work. But think about what was actually at that conference. There was an entire wellness section in the exhibit hall of the conference. There was morning yoga sessions, there was chair yoga, there was movement and stretching breaks built into the programming. There was mental health, physical health, spiritual well-being, all represented. This conference literally embodied the World Health Organization's definition of health, not just the absence of disease, but complete physical, mental, and social well-being. This wellness director absolutely belonged there, and she knew it. So what was lost? Let's think about the ripple effects of this missed opportunity. Students at that university missed out on seeing how their wellness services connect to public health careers. They didn't get to have conversations with the wellness professional at the public health booth, someone who could have helped them see new career pathways and possibilities. Conference attendees missed the perspective of a wellness professional in the public health space. They could have sparked conversations, important conversations, created new collaborations, and helped others see these connections more clearly. The wellness department missed an opportunity to expand their visibility and impact, to connect with the broader public health community, and to really position themselves as part of the solution to student health and well-being from a population health perspective. And the public health department missed the chance to have a differentiator at their booth, a wellness expert who could speak to an aspect of health that draws people in and opens their eyes to the breadth of our field. Think about it from a student perspective. When departments understand these connections, they can better educate students about career pathways. Students aren't just learning they could be a gym teacher or a psychologist. They're seeing that they could take wellness into public health spaces or public health training into wellness careers. They could work in corporate wellness, community health, nonprofit wellness programs. The possibilities expand exponentially. And for the university, there's a practical benefit too. Better career outcomes. When you help students understand the breadth of opportunities in their field, you're investing in their success and their ability to make an impact wherever they land. Now, the leadership gap, let's discuss that for a moment. This story highlights a critical issue. Sometimes the barrier isn't at the ground level. This wellness director got it. She saw the connections, understood the value, and wanted to make it happen. The barrier was leadership. Decision makers who didn't understand the landscape well enough to recognize the opportunity in front of them. This is exactly the kind of challenge where education, communication, and advocacy become essential. Someone needed to help that department leadership see that public health isn't just epidemiology and disease tracking. It's wellness, mental health, community engagement, and health education, and so much more. And when leadership doesn't understand this, they don't just miss conference opportunities, they limit their department's potential, their staff's professional development, and their students' understanding of career possibilities. Let's talk about the communication challenge. This story also reminds us that we need to communicate what public health is, not just to the general public, but sometimes to our colleagues and partners in adjacent fields. In this case, departments within the same university needed help understanding each other's work and seeing the connections. How many times have you encountered this in your own work? Someone in healthcare who doesn't see how public health fits. Someone in education who doesn't realize they're doing public health work. Someone in community development, social services, or mental health who's never connected the dots. We have a responsibility to help people see these connections, to explain, to educate, to advocate for a broader understanding of what public health encompasses. Where we are right now, well, there's a broader context here too. Public health has been going through a major shakeup. For some people, when they hear public health now, they immediately only think of disease and vaccinations. The light has dimmed on what public health really encompasses, but that means we have an opportunity and maybe even a responsibility to expand that understanding again, to light up the whole room and show people the complete picture. This isn't just one small piece that can be pulled apart. It's an interconnected field where wellness, epidemiology, health education, community health, mental health, and countless other areas come together. We work together. And that interconnection is exactly why collaboration is so important. Now, what can we do? You may be asking, what can we do about this? Whether you're an early career or you've been in the field for decades, whether you're a student or a seasoned professional, you have a role to play. First, recognize these moments when they happen. When someone says, that's not public health, about something that absolutely is, speak up. Help them see the connection, share examples, explain the breadth of our field. Secondly, we can advocate within our own organization. If you see opportunities for collaboration across departments or with partners who don't realize they're doing public health work, make the case. Help leadership understand why these connections matter. Third, mentor students and early career professionals. Help them see the full landscape of possibilities. Show them that wellness is public health, that community development is public health, and so many fields intersect with and strengthen our work. And finally, be the bridge. If you understand these connections, use that knowledge to bring people together, facilitate conversations, create opportunities for collaboration, help break down the silos that limit our collective impact. Because somewhere right now, there's another wellness director who sees the connection but can't get buy-in from leadership. There's another department leader who's dismissing opportunities because they don't understand the language or the landscape. There's another student who doesn't know about the career path that could be perfect for them. And we, all of us in this field, can help change that. So here's my challenge to you. Pay attention to these moments. When someone says, that's not public health, about something that absolutely is, speak up. Help them see the connection. Be an advocate within your organization. Mentor students and early career professionals. Show them that full landscape of possibilities. And be the bridge. Use your knowledge and bring people together and break down the silos that limit our collective impact. The field of public health is broad, interconnected, and full of possibilities. Our job isn't just to work within that space. It's to help others see it, understand it, and be a part of it. If this story resonated with you, or if you're facing similar challenges in your work, I'd love to hear from you. My friends and colleagues, keep making connections and showing people what public health really looks like. I'd like to remind you of one more thing as I wrap up. We have a podcast app and private community, independent of social media platforms, where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes like this one. You can download our PHEC podcast community app in the mobile app store of your choice. It's available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.